machine, I'll just start talking. It'll pick up my voice, won't it?
Yes.
Okay, so we want to pick up the front here and just get this. Tell me when to roll.
2. Go ahead.
Okay, this is the EMS Doller class machine. This is considered a non-focused extracorporeal shockwave machine. The purpose of this machine is to create sound waves that are extremely strong that will go in and pulverize to some extent the soft tissues in a medical way so as not to injure them, but to create a type of trauma to the area that will stimulate new vascularization to the tissues and create increased healing. This product has been used over several million people over the last 15 years. It's very safe and it has great efficacy and good results in over 200 medical papers that have been published in the world literature. This is used for treating some fractured bones that don't heal. It's used for treating wounds on soldiers from Afghanistan and from Iraq. And it's used on treating heel pain like plantar fasciitis, tendinitis, shin splints, patellar tendinitis, tennis elbow, problems of the shoulder, and any soft tissue areas around the body. Now, on using it, here's what we're going to do first. Obviously, turning it on. Once the machine is plugged in, this is the turn on button. We'll turn it on and we have all these values come up. Typically, when we're giving a treatment, we usually use approximately 2,000 impulses, and the way we can do that, press the button called select, the first button here on the right, and then we can increase the numbers as we go along. So we'll start at 2,000, and to go to numbers inside 2,500, and we can, that's on that one. Next one we'll go to is on impulses. I have to get around to the other side so I can see what I'm doing.
Oh, it is.
Okay, validate that. I'm going to go back to select again, and we're going to keep it on that area. The next one we want to look at is these little areas down here. When we see one little item sticking up here, that means that we're only going to give one shock at a time, but we want to give multiple frequencies. So we like to push this column right here somewhere between 8 and 9. So we're going to go up to that area. Somewhere between 8 and 9 is about the normal one. I'm going to put 8 on this particular time. When we have all our values set, we have 2,500 preset impulses. Going to do it at a frequency of 8. We can press the validate button, which is the second button from the top, validate, and that locks everything for us. Okay, inside the unit, I think you have a pretty similar unit. You'll find the foot pedal that you can utilize. And depressing the foot pedal starts the machine working. So we'll have it on in that particular area. So now we look at this dial. That's the next important area. This is the air pressure that we want to get. And we start with, it goes up to 4 bar. Each bar is 1 atmosphere of pressure, and that is considered 15.2 pounds of pressure. So we start, usually with most people, you can start at about 1.5 to 2 until they get the hang of it. You'll hear this little noise going on. So that's the frequency. If I turn that frequency down, you'll hear it go slower. I'll turn it up. Sounds a little bit like a machine gun. So we found the most effective to be about in the 8 or 9 category, but you can kind of play around with it. So the next thing we're going to look at is the power of the machine. What we usually find is it's best to start someone at about 2 bar with the arrow straight up and down and get them used to it. Now, very important to look at this particular area. You can see as I push this down, the cylinder goes down and there's 2 lines. A line down lower here and a line higher. You want to press it so that somewhere between the 2 lines is where the force is. So when I push on my hand, it's somewhere between the 2 lines that you'll be doing it. Don't go all the way to the top, but somewhere between them. Next, I'm going to turn this frequency all the way up to 4. This is now 60 almost 61 pounds of pressure for every one of these little bounces. And I'll put my hand on it. Don't do this at home. And you just pound away. You can practice on this yourself and see how well everybody can handle this one. Okay, now we're going to go to a typical patient here that has plantar fasciitis on the plantar aspect of his heel, typically in this area. And the first thing we want to do is to put some gel on it. Just like we would be using ultrasound. This will give us better contact for the shockwave unit. This stuff starts to splatter a little bit, so I suggest you kind of have a Kleenex handy so you don't get splattered all over the place. So we'll start right in this area, and it's turned up all the way. We got a nice strong volunteer here who's not going to have any pain with this. Okay, we're going to put this right on that area, and we move this around and go in a little circle like this. And when you find the area that's the most intense pain, try to stay right in that spot and just rock it up and down when you're in that spot. We're going to go around that area, finding it like that, about the size of a silver dollar, so that you get it all. One good thing to do is have your athlete take a little marker or a ballpoint pen, mark the area that hurts him the most after he stands up, and then you have kind of an idea of where to go. So for the plantar fascia, that's how we would do it, or for any other areas. Now, if he has pain with his Achilles, got a couple of different ways we do the Achilles. First of all, the Achilles pain might be up in this area. We're going to start at the back end and go here with it, up and down. And then a real important point, we kind of dig it in from the side here. Herm's going to love this one because this is like that little metal comb he uses. It really blasts away to try to get the undersurface of the Achilles. The undersurface has the peritoneum, and the peritoneum is what has most of the blood supply to the Achilles. That's the one we want to stimulate. So do part of the dose on the outside of the Achilles and part right in here digging into that Achilles, trying to get underneath it with this. Very effective for that particular problem. It can be used in calf muscles, up in this area, up in the calf, thigh, wherever it is, wherever the pinpoint pressure or trigger points are, there's good use in that area. And once one has the confidence of this, it's not going to hurt him. It is not nearly as painful. So anywhere from 2,000 to 3,000 of these impulses are what we typically use per treatment. No one has ever been hurt by this machine. We've done FDA studies on it. They had no adverse events, as we call it, ever occurred. So it is definitely safe, but it is a little painful, especially when you're dealing with a painful situation. So we just turn the dose down on that dial. You can go down to 3 and give a complete treatment at 3 if the athlete can't quite handle it. And they shouldn't feel bad. They can get it the next time. They'll have more confidence and they'll be able to go up to that area. There's really no working parts that have to be dealt with. I would suggest taking out every so often, taking the head off of it. Just unscrewing the head here because it gets a little bit of the ultrasound gel on it. And you can just clean this area a little bit. This is the plunger, so you can just take out that little plunger and kind of clean it up a little bit. Take the little rubber washers off, and then you can put them back on again, just to make sure it's nice and clean and sharp. The washers have never been broken or anything like that, but if you do lose one of these for some reason, you can always find a store that has these little black washers on there, but otherwise we just kind of leave them alone. And basically that's the only moving working parts that work on this machine, and highly valuable in all of these areas. So we hope you have no problems with this. If you do, just let me know, and we'll give you some tricks on how to do other things. If you have any questions, 847-344-7441. Okay, thanks a lot, and take care. Bye-bye.